Tomorrow is Daffodil Day, in which the Cancer Society raises money for research into the causes and treatment of cancer and for providing support for people having cancer treatment. That fundraising is required for such things speaks of the supply and demand equation of funding cancer treatment. The demand is great, the supply is determined by government funding and a Pharmac decision-making model called Factors for Consideration. Now, we've tried again to speak to Pharmac about this. Is that model working? Are Pharmac constrained by budgets, or do they, like others in the health system, ask for more money? When they compare the availability of cancer drugs in New Zealand with Australia, do they compare the breadth of availability? Why does Pharmac take 3 years to review a new oncology drug application, and so on? Once again, our request for an interview was politely declined. I think it's the third time in about a month. But Chris Jackson, an oncologist who's medical director of the Cancer Society, says these are questions for Pharmac to answer.
There are so many things that we do very well. We have world-class surgeons. We have fantastic screening programs with breast, bowel and cervical screening. We have excellent hospitals that work very well within the resources they have available. But we still fall short of our comparator countries like Australia and Canada in terms of our survival outcomes for cancer.
Do we?
Yes, we do.
It depends on who you're talking to, because Pharmac is saying that we're absolutely comparable with Australia.
In terms of cancer outcomes, it's clear from the Concord study, which is an international IARC-funded study looking at cancer outcomes across a number of countries, that compared to our similar countries, we are not doing as well. So we're doing pretty well compared to low-income countries, for sure, but we're not doing as well as Australia, and we're not doing as well as Canada in terms of our cancer outcomes.
And yet, sorry to interrupt, but if I just want to look at Pharmac's response to this, because they've done this survey called Mind the Gap. And they come back to it over and over again, the Mind the Gap study. And to précis the big picture of the 35 medicines not funded in New Zealand that are funded in Australia, Pharmac say only 3 provide real, meaningful benefit. And I think they've actually started funding one of those.
That's right. So that study that they published 2 years ago was a deeply misleading, deeply flawed study which is rejected and criticised by every oncologist who I've spoken to. Several oncologists have written to international journals criticising the methodology and the practice of that study. Pharmac listed some drugs there which they said were no good, which they then went on to fund. One of the drugs they said was no good was a drug called pemetrexed. And within only a few months of publishing that study, they went ahead and funded it. So either they're funding drugs that are no good or their methodology was wrong, one of the two. Now, that study looked at if a drug was funded for anyone at all in New Zealand, and if it was funded for anyone at all in New Zealand, they said it was exactly the same as if it was funded for a whole bunch of people in Australia.
So what you're saying is that there are drugs funded in both countries, but funded for the treatment of more cancers in Australia. Can you give us an example?
Well, a good example that I know for sure about is a breast cancer drug called pertuzumab, which is funded for a limited number of people with advanced breast cancer in New Zealand, but is funded before and after an operation for many, many more women in Australia. Another drug which Pharmac now fund for head and neck cancer called cetuximab is not funded for a very large group of bowel cancer patients. It's funded for both in Australia. Pharmac's methodology would have said, well, we've got the same access, which is patently not true. And the oncologists who I've spoken to felt that study was misleading and misrepresented the clear situation. But, I mean, drug funding is only one small aspect of the bigger picture of cancer, and there's a lot we can do to improve the outcomes of New Zealanders with cancer. Drug funding is one of them. It is the shop window for many people, but cancer is clearly much, much broader than just drug funding.
Okay, let's look at the way Pharmac develops its attitude towards drugs, and the classic was Keytruda, which you talked about with us on Checkpoint a couple of years ago. There were public protests, there was petitions, and then in the end Pharmac funded it. Now, Pharmac say, and I've got all of it just spread out on the desk in front of me, the funding of cancer medicines during the year was a story of how evidence and knowledge evolves. That's a fair point, isn't it?
Well, I think it's true to say that because the pace of change of medical research, cancer research in particular, is at a pace never before seen. So in the last 10 years, the standard of care for lung cancer may have changed once. In the last 2 years, it's changed about 5 times. So the pace of change is like we've never seen before. There are now 5 clear international standards for different groups of patients with lung cancer. We have got access to one of those 5 standards of care in lung cancer.
But
so
Pharmac,
we are falling behind.
Okay, but Pharmac says its objective, and this is in an email to us, is to achieve the best health outcomes for New Zealanders from pharmaceutical treatment within the funding available. And that's the key phrase, isn't it? So within the funding available, there has to be demonstrable efficacy before they can write the cheques.
Well, absolutely. I completely and utterly agree with that. The other points around that, though, is that Pharmac's budget isn't fixed. They are able to petition the Minister for an increase in their funding pool every single year, and they have got medicines on their waiting list at the present time, which they're not asking the government for more money for. So they're not advocating on behalf of New Zealanders to increase the size of that pool. And what we're talking about is medicines that improve the health gain. So why would you not give additional funding to improve and give extra over and above what we already do? So if you're getting more groceries in your basket, you expect to pay a little bit more. What Pharmac is saying is they want more groceries in exactly the same budget. When it comes to cancer drugs, the question is, have we got access to the world's best medicines? The answer is no. Are we keeping up with other countries? The answer is no. Are there possible improvements to the Pharmac model that could actually deliver us better outcomes? I think the answer is yes. Currently, it takes Pharmac 3 years to review a new oncology drug application. Why does it take that long? In the UK, they've got published timeframes for we're going to review the drug on this date, we're going to have a consultation process, we'll have feedback, we'll have input, and they make a decision by a set date. There are no timelines in New Zealand. Pharmac say we review the evidence, but they've got no use of goalposts which said if you meet a certain cost-effectiveness threshold, then you will get funded. In the UK, the goalposts are clear. In Canada, the goalposts are clear. The goalposts move. There are objective evidence scales like the European Medical Oncology Magnitude of Benefit Scale, which you can use to put a ruler over the strength of evidence to look at it, and they're not using those sorts of objective measures. So it gets cloudy, it gets obfuscated, and it lacks transparency.
Can we look at one drug in particular, and that was the one that there was a petition presented, that there was a gathering outside Parliament, that there was a great deal of publicity around, and that was Keytruda. At first, Pharmac didn't want to fund it because the efficacy was not demonstrated. Then they did fund it, and it is funded. But when you go to give a little and search the word Keytruda, you find 63 appeals for money for Keytruda. Is it funded or not?
It's funded for a certain group of patients with melanoma only. It's not funded in lung cancer, bladder cancer, lymphoma, and Merkel cell carcinoma, and any of a number of other range of cancers. So it's only funded for a small number of people. And that would be around 200 or 300 people a year. But there's many, many more who could benefit from drugs like Keytruda and others. In terms of the evidence, the Pharmac said the evidence evolved, which is why they funded it. But that's not entirely true, because from the time they said not enough evidence to the time they funded it, not a single additional clinical study was published. It was all a commercial decision. It was all about the dollars and cents.
Dr. Chris Jackson, who's an oncologist and medical director of the Cancer Society.